With me in the Frank N. Anderson Broadcast Center is Dave Przybylski, who is the Division Chair for Health and Wellness here at Delta College. Dave, exactly what is health and wellness?
Health and wellness at Delta College is a variety of programs that are related to health, but they're also related to occupational health. Programs like nursing and dental, physical therapy, surgical technology, respiratory, radiography. So a variety of occupational programs that exist out in the community, out in our hospital settings, out in our clinic settings, in our doctor's offices. So in addition to having a focus on what you do for yourself personally from a health perspective, we have a big impact out in the community related to a variety of occupational positions that have a direct impact on providing care for our citizens in the region.
You mentioned nursing, which is always a big part of the health and wellness. One of the things we hear about in the community is that in nursing, there are wait lists. And I'm hearing that that's a great frustration of nursing students. First, why is there a wait list? And secondly, what kinds of things is the college doing to alleviate or eliminate wait lists?
Mm-hmm. Well, first off, I think the fact that we have a wait list speaks a lot about some of the quality of our programs. And actually, all of our programs do have wait times at this time. But as I said, I do think it speaks a lot about the quality of our programs, because there is a strong need, there's a strong desire that we fulfill for the community to have these students complete these programs and then enter into the workforce. But things that we are doing at Delta College to really address the wait list are really working with our clinical agencies. So on an ongoing, continuous basis, we work with our clinical agencies to see where we can expand opportunities, what can we do. That is constantly ongoing, even at times when we may not see the strongest demand. A couple of years past, there was a huge nursing shortage demand where people wanted nurses immediately. We did step up to that challenge. We increased our enrollment in the programs. We worked with our area agencies to put more students into the clinical settings to meet those needs. At the same time, we always have to balance that with making sure that when our students do graduate, there are jobs out there. And even though their nursing and respiratory and physical therapy remain strong in terms of job aspects, we have other programs that are smaller that also we have to be careful that we don't produce 50 sonographers, for example, because the industry doesn't call for that many.
You use the term clinical agency. What is a clinical agency?
Okay. Well, most of the time people think of hospitals, but and those are our largest sites for our students. But we do utilize doctors' offices, and we go to our long-term care facilities, so we are out and about, so we are utilizing Midland Bay and Saginaw County.
So a clinical agency is not something the college creates. It's in existence. I mean, it's as we can't create clinical agencies, there has to be the invitation, and then it has to be the appropriate setting, if you will.
Correct.
Is it fair to say that the bottleneck, if you will, as far as creating the wait list lies with the number of clinical opportunities?
That is part of it is that indeed we do have to secure enough of the appropriate clinical sites and agencies to have our students get into them. But once again, like I said, you know, we are working with the employers to say, oh, well, how many nurses do we need to graduate each year? How many radiographers do we need to graduate each year? Mm-hmm. So even though we have a strong demand for our programs, we want to be careful that when our students do graduate, they have jobs and opportunities to go to. And so it is a fine line, it is a constant balancing act, and it is important that we are working with our clinical agencies that are external to us, that we're meeting their needs, that they see that the students that we're sending them are professional, well prepared when they come into the clinical settings, mm-hmm. because when they're here, they work within a simulated lab setting. Right. And then once they enter into that setting, they are actually working with real patients, people that are in need of care, and so they have to be prepared and ready to act in those situations.
What's new in health and wellness?
Yeah.
Anything new on the horizon that we should be looking out, students should be looking out for?
Yep. Well, in the near future, we're going to be seeing a renovation of our health building, and in that health building, many of our services are going to be updated. We have a fully functioning dental clinic that provides services to our community, and so that will be fully upgraded. I think the other big thing that will come forth is our focus on simulation in our practice settings here at the college, because we'll be able to fully update those and provide a much more enhanced learning opportunity for the students. And the big focus is really going to be to do a multidisciplinary approach. So we will have nurses and respiratory and radiography working together in particular situations to try to promote greater learning.
So the expansion of the health and wellness will enhance student success and really enhance the quality of the program that these students participate in.
For sure. That is, to me, I think that's going to be the biggest benefit that we're going to see. We're going to see students that are being given some of the best exposure to what exists presently.
The best technology.
The best technology, but even our faculty, things like that. We have so many good opportunities here, and they are going to be exposed to some really good learning experiences, and we are continuously looking at what's out there in the environment to help to improve student success. And we have even some opportunities with some of the medical programs that are coming into the area, and some collaborative efforts there as well.
Dave Przybylski, Chairman of the Health and Wellness Division here at Delta College, thanks for coming in and sharing with us all that information. Appreciate it.
Thank you. It's nice to be here.